Formally welcome you all to the Lock Your Meds campaign. I see just a couple more folks have just logged on, so welcome. I would like to ask everyone please to mute their phones so that we don't have the interference of the background noise, so I appreciate that. We will have some time at the end of the webinar for you to have an opportunity to ask any questions. All right, so here is going to be our table of contents for this webinar. We're going to do a brief introduction on what Lock Your Meds is and an overview of what our state is doing with this campaign. And we're also going to do just a brief little overview of prevention. I know that most of you are already working in prevention and have this knowledge, but there are some organizations that are joining in on our campaign that are not working in prevention. So I want to just give a quick overview on that. And if you are one of those folks, I'm more than happy to spend a little more time and go into a little more detail with you about prevention and about the type of strategy that this media campaign is. Then we're going to go on to discuss what a media campaign is and what the benefits are for our individual communities as well as our state. And then we will go over the list of materials that you all are going to be receiving and the resources that we are going to be able to provide for you. Then we'll also go over your expectations and what the timelines for those expectations are. And welcome to whomever just joined in. We're just getting started. So an introduction to Lock Your Meds. Lock Your Meds is a national multimedia campaign designed to reduce prescription drug use by making adults aware that they are unwitting suppliers of prescription medications being used in unintended ways, especially by young people. So this campaign is produced by the National Family Partnership, referred to as NFP. And there on the right side is one of the graphics. So there are 4 different print graphics, and they each kind of have a little bit different message. And we'll get into a little more detail about those when we get to the materials package. North Carolina has a targeted response to our opioid crisis, and that's what this grant is all about. So we, being the state of North Carolina, received this grant funding on May 1st of this year. This money is coming from the 21st Century Cures Act. The state is using that money kind of as in a continuum of care targeting the opioid crisis. 80% of the funds are going to support outreach, engagement, treatment, and recovery services. So our prevention dollars that we have received for this are just a small part of this overall grant that the state is using to target opioids. So there's a lot of treatment and recovery services umbrellaed under this grant. So we are a small part of that. With this media campaign, there's kind of 2 parts to it. So the state is doing their own work with this campaign. So they will be doing a statewide broadcasting of this campaign. Then you as recipients will be doing the same things but more at a community level. So you will see these same ads that you're going to have license to and that you're going to be using. You will see these in other places across the state, even in your own communities that the state has funded and that the state media specialists have placed. So the work that you're going to be doing in your community is just going to further support that statewide blanket of this campaign that they are doing. We all know that the more a message is received, the more benefit can come from that. So there are already some organizations throughout our state that are already using this campaign. So many of you have probably seen some of this Lock Your Med media. A lot of the PSS sites are using those, as well as just some organizations that have funded that on their own. But now with this grant, we are able to supply you all with these products without you having to purchase them. Okay, let's just do a brief overview of prevention for those folks who are not working in prevention. Prevention is a comprehensive approach to behavioral health. It also means seeing prevention as part of an overall continuum of care. So it goes along with treatment and with recovery. It is an integral part of that. So prevention is delivered prior to the onset of a disorder. These interventions are intended to prevent or reduce the risk of developing a behavioral health problem. And in this case, this campaign is going to be specific to preventing or reducing the risk of prescription drug misuse. So there are two different approaches to prevention. There's the individual approach where you are educating or working with that individual. Then there is also an environmental approach. And so this strategy is what our campaign falls under, is an environmental strategy. So environmental strategies they're approaches that intend to change the environment. So it takes a broader approach than an individual prevention effort. They're used to change conditions within a community, including physical conditions, social conditions, cultural factors. They influence structures. So they are most effective when they are part of that comprehensive approach. Like I mentioned before, they support that individual prevention. So there are lots of things included in an environmental strategy, and they do include communication and education, and they seek to influence community norms by raising awareness and creating community support. So think of them as influencing conditions, standards, institutions, structures, systems, even policies that can influence informal policies as well as formal policies. So my favorite analogy that I have used for years in prevention are Oreos. We all know what Oreos are, one of my biggest weaknesses. So I, as an individual, have been educated on the fact that Oreos are not healthy for me. But when I walk into my local grocery store and there's a big display of Oreos right in front of me and they are on sale, let's say, or there's some type of promotion with them, I am more apt to purchase those Oreos than I am if they are on the shelf out of sight where they're supposed to be, because I will just avoid that aisle. So that's kind of how that environment can affect our behavior and our decisions. You know, I'm not going to specifically go look for the Oreos, but if they're in my face, they're going to be in my cart. Same thing with them being in my own cupboard at home. If they are in my cupboard and I have access to them, I am going to eat them. But if they, however, are not in my home or I don't have access to them in my home, I'm not going to get in the car and just go and purchase them unless it's an emergency. All right, so let's dig a little deeper into what a communication media campaign is and what it can mean for our community and how it can help us build capacity within our coalitions or our organizations. Media campaigns absolutely can aid in the prevention of non-medical use of prescription drugs and overdose by increasing the knowledge and awareness of risk, by changing attitudes and beliefs, by increasing positive social norms, by changing structural factors, and also increasing the availability and accessibility of health services. So media campaigns are important, are beneficial when we are looking for widespread exposure and a wide reach. They also are great when we are wanting to get the message out quickly, and they reinforce that education that folks already have or that you are working on in other areas. media campaign can reinforce that education and that awareness. So there are 4 different phases when you are implementing a campaign. And I know a lot of you who are already working in coalitions are familiar with this, but I do want to just kind of give an overview and give an outline of how the campaign rolls out. And no need to panic because most of this has been done for us already. So we just have to put all this into place. But for those folks who are not familiar with these phases, I did want to kind of just briefly go over them. So the first phase of any campaign is planning. And again, most of this has been already completed for us. So in planning, you want to, the first stage is to define your target audience. Well, that has been done for us. With Lock Your Meds, our target audience is adults. So I know that most of us are used to our target being young folks, but this campaign is targeted at adults in order to protect our youth. So that will be our target, and primarily parents and grandparents, but all adults who could have prescription medications in their home. But we know, obviously, parents and grandparents are most likely to have youth inside their home, but anyone is, of course, would have the opportunity to have youth in their home. So the second thing would be developing a team and securing support. So this is one part that you do have to do. I know most of you have teams kind of already in place. So think about kind of building up those teams, securing support from your existing teams, but also think about some new community partners that you may be able to bring into this campaign. We are absolutely encouraging you to build on those relationships and resources that you already have, and are hoping that this is going to kind of open up a door for some of you coalitions and organizations to reel in some partners maybe that you've had desired in the past, but maybe haven't had the right draw for them, that this may reach a few more folks, because a lot of you I know have, like I said, that focus has been on youth, and since this is more of an adult target, so think about maybe some of your elderly serving agencies, or, you know, some of your agencies that work more with adults than youth that maybe haven't had so many opportunities to partner with your coalition or organization. Hopefully this will be a good time to get them on board and build new relationships. So you want to also assess your resources and your capacity with this campaign. And again, hopefully that will involve some partners. So we want to encourage you to secure partners that obviously are going to support this same initiative and that have access to our target audience and who have the ability to promote and distribute this message, and also partners that are credible and trusted in your community, and that have resources available to them. And we, of course, as always that we hear in prevention, is we want you to try, when choosing your partners, to choose some that are going to provide some sustainability. So think about those partners that could carry on the message in this campaign long after this grant is finished, and also some ways that you will be able to sustain this message. So then in developing, you are going to want to identify your communication channels. So think about where adults in your community are getting their information from. So are most adults in your community on social media, or do most of them still read the newspaper, or most of them watching your local television? And we are going to provide you all with some ideas. We just kind of brainstormed yesterday and thought about putting a list together for you all of ideas where you can get your message out. As an example, Erin, with her coalition in Wilson County, they were able to secure some spots on a local grocery store shopping cart. You know how we're like in a little seat where there's usually a little placard with a message or ad on that. So we do encourage you to think outside the box, and we would love for you all to share some successes maybe that you've had with other campaigns, other messages where you've thought outside the box, outside your traditional billboard or radio ad or TV ad, some of those places where, of course, most of us are on a budget, where we could get those in place. So back to the development slide, messages. The message has already been written for us. Yay, we don't have to create anything here. So just when we are getting that message out, if we are doing that verbally, obviously we just want to be clear with our intentions. And then a distribution schedule that we are going to assist you with that and give some guidelines on that. But of course, that will be up to you to decide who's responsible for what and in what type of timeline. Then implementing it, for implementation, there are two phases. There's a pre-launch prep and then the actual launch. So the pre-launch is just starting to engage your partners and your key stakeholders in your community. So you can go ahead and start letting those folks know that you all are going to be part of this campaign and start kind of prepping them for that, and go ahead and start thinking about what resources you have for different media channels. There are direct marketing channels. That's going to be like your television, radio, public service announcements, billboards, banners, bulk mailings or email lists or websites, special events, those kind of things where you are directly sending that message to your audience. Then there are also indirect marketing channels. So that's going to be kind of think of that as going through a middleman. So maybe you getting this message to your local leaders, your faith-based organizations, and then them relaying that message to their folks. Then there's also organic or social media digital channels. So there are things like Facebook, Twitter, Snapchat, whatever social media outlets that adults in your community use. So you can go ahead and start thinking about those things. And then when you get to the point of launch, which is going to be very soon, coming down the pipes, we're hoping that you'll start with a press release, and we will be providing a template for you so that you can pass that on to your local media. Also encourage you to do any kickoff activities. If you've got some activities or events already planned, would be a great time for you just to tag these on. If not, this is a great opportunity and good occasion to launch a new activity or event. And then, of course, distributing of your physical materials and so forth. Evaluation, and no need to panic about that either. You will be getting templates for your quarterly reports, and those will have everything in them that we will be requesting from you as far as your evaluation. But of course, keep in mind too, all throughout the campaign, as we do all initiatives, us working in prevention, is that we know that we need to continually evaluate and make sure things are going well. But that will all be outlined for you. All right, so I'm sure most of you are anxious to know what type of materials that you are getting. Here are a couple other of the graphics. The wording is just a little different in each to kind of target different audience. Like one says, that he gets his drugs from his friend's medicine cabinet. Another one says uncles. I think one says grandparents. One says parents. And Okay, well, here's a list of the packages that you all will be receiving. And yes, we initially in your application ask you all to specify what products and approximately how many of each product that you would like, but due to the awesome, overwhelming response, we have decided to just streamline that package of physical materials. So everyone is going to be receiving the same amount. We will be putting those together and getting those out to you very soon. If you do not want that streamlined package, you know, if for some reason, say you do not want magnets, then you need to let us know by August 30th if you do not want this full package. This package is going to include, from the get-go, 50 lock boxes, and I hear you all cheering through your mute. I know this is exciting. We're certainly excited about it, and you will be able to request more once, if you get through this 50 or know that you're going to need more than 50, just need to give us a little bit of detail on, you know, how you have used those and what your plan is for that. So please just get in touch with us if you need any more of all the materials, not just the lock boxes. You'll be receiving also magnets, rack cards, you know, and the rack cards are like a flyer. It's what you would put in the card racks at doctor's offices or, you know, in entryways of businesses. You will also be receiving posters, and you will also be receiving license for the digital version of the commercials, which I did not have the commercial to add to our webinar today, but we are going to be emailing you all that commercial or those commercials so that you may see that. So that the digital version is to be used online, you know, so on computer or on the phone, so for like Facebook and that type of thing. Then you will also be receiving a broadcast license for the commercial, and that's the version that would go for TV and also a radio ad. And again, you do not have to create these ads. You will own the ad. You will just have to get it placed onto your radio or television channel. And you will also be receiving the print license. The rack cards and the posters have a place on them, a small place that you could add some personalization, like for your organization or the name of your coalition, like on a mailing label, like that type. The licensing for Lock Your Meds, they do ask that you do not cover up any existing logos or any existing part of the ad. So just finding that spot on there that is blank that you could add your own sticker. And some of the rack cards are different on the back side. They offer some more individualized information, like some of them are targeted more like to elderly folks. So, you know, obviously you would place those in a place where you're reaching elderly folks. So different messages on the back for different demographics. So back to the licensing, once you have those, the media space and time, that will be on your own. We do not have the funding for buying your ad space or your ad time. So that we, you know, hope that you all are able to get possibly some in-kind or just some donations. If you have local channels or stations that offer, you know, public service announcements, you know, or if you have a media organization that you've worked with in the past that will give you a discount, things like that. And we are available to help you all, help coach you through that. If you don't have those kind of resources and have that available to you in your community, we are more than happy to give you a little more detailed information on how to obtain that. And okay, let's move on to expectations and timelines. So the first date that you need to have on your radar is going to be September the 4th, which was brought to our attention yesterday that is Labor Day. And most of us are going to be enjoying the last bit of summer and not working on that day. So Anna said that September 5th is fine. And if there is some reason that you are not able to get us that report by September 5th, just let us know. She said she's not going to be too strict and hold everyone to that exact date, that if you have something going on and you need a little more time, please just let us know. So in that first report, we're calling this a tentative media plan report, and Anna is going to send you a template for that, so it'll be easy to follow and just fill in a little bit of the information. We're going to want to know who your intended community partners are and your plan for sustainability after this year, so how you hope to keep this message going beyond this grant, and then also how and where you are going to use your materials, like ideas that you have for your media and your media purchases or your in-kind donations. And you will not, this obviously is tentative, so you will not be held to every word of that report, obviously. Okay, yeah, here was just a little more information on each of those. So I think we kind of already went over all that. And then your first more formal report, your first quarterly report, will be due on October the 23rd. And again, Anna will be sending you a template for that. So that should be easy to do. So don't panic. We are trying to make everything easy and kind of streamlined. So on that report, we hope that you will have 2 pieces of earned media or submitted print media. So, for example, a letter to the editor that they put in the paper, that will be a piece of earned media. Or say you promote this campaign at an event and that gets covered by your local paper or a school newspaper or something like that. That is a earned media. So different things like that. And if you need some more detail on that, we're happy to provide that. We also would like to have some pictures of how you have used your materials. So if you have put the rack cards or a poster up in a local business, just to have a quick little photo of that. We hope to get some success stories around the use of the campaign from your launch until October 23rd. And then just a brief description of how many materials you have distributed. So I know from personal experience that's sometimes hard to keep up with how many that you have distributed. So just personally, what has worked for me in the past is I usually will count those out in like sections of 10 or 50, and then I know that way I can kind of keep an inventory and not have to count out each individual one and try to go back and figure how many I've used. So just whatever works for you. That's just a personal tip that I've found useful. And then on that quarterly report, we also would like a list of the community partners who have assisted you up until that point, and then also a completed call with me. So I will be reaching out to each of you prior to October 23rd to check in and see how we can assist you or if you need any assistance. But certainly if I have not reached out to you before that date, you are welcome to call or email me at any time for any assistance. I'm happy to come out if you need me, or phone call or email. Just let me know. So here are some other resources that are coming your way very soon. The materials, those will be sent out, I believe, mid-September Erin, you can correct me if I'm wrong. We hope to have those out by mid-September to you. But if you would like to go ahead and receive your license for the media license that we went over before, you may request those now. If you are anxious and ready to go ahead and get this out,
Holly?
You can start on that end. Yes.
Hey, sorry to interrupt you.
No, you're fine.
As far as the materials are concerned, the tangible materials, you're right, will be available will be sent to the site by mid-September. And we plan to send the licenses out by or next week. So you'll have those.
Okay. So those are automatically going to be sent out. They don't have to request them.
Right. Mm-hmm.
Okay, great. All right, and you also are going to be receiving a toolkit, which is going to basically take you step by step through this entire campaign process. There's even a worksheet for a checklist that it is all just laid out there for you. It's awesome. Virginia with the state had, I think she did the bulk of the work on that and has put together a great toolkit for implementing a media campaign. So I'm sure you all will be excited about that. We'll also be sending out a copy of this webinar for your reference, and then you'll also be receiving the templates that I mentioned before. One will be for you to write a letter to your editor, and also for a press release, and then also templates for those reports. And then I will also be sending you some web resources that I have collected on media campaigns and also how to secure some community partners around the campaign. And then I will also be giving you a call. And again, to reiterate, if you need me prior to that, please feel free to call or email me. And I have included on this slide my email and also my direct cell number. So feel free to give me a call anytime. You can also text me on that number if that works best for you, if you just got a quick question you want to shoot out. And then our campaign email is listed below, and Erin and Anna both received that one. And that one, just in case you didn't see Anna's last email about the email correction, this email was incorrect on the acceptance and congratulations letter that you received. She had .org on that, and that, excuse me, email is .com. So, Erin, is there anything else that you would like to add or anything that you would like to elaborate on that we've already discussed?
I don't believe so. I would encourage community to not be overwhelmed by all that has taken place on this webinar. It was a lot of information up front, but you guys know how to do this, and I think it could be really powerful for your communities. So if you get held up on something, and don't hesitate to reach out to Holly or to Anna and I.
Yes, definitely. So we would like to open up for any questions that you all have or comments. If you want to share some ideas, go ahead and unmute your phone, and we'll be happy to try to answer that. Also, if you would like to request any time to go into a little more detail about anything that we've mentioned here, especially about prevention, if you're not someone who is working directly in prevention and you want a little more info, I'm happy to provide that.
Hi, this is Diane Pierce County. I have a question about localizing the digital portion. So I understand what you mean by the printed posters, etc., with the stickers. But is there a way for us to localize the digital, the commercials, etc.?
To my knowledge, there's not a way for you to personalize the broadcast media. There may be a way that we could ask for digital, which would be like your social media type ads. I'll have to check with the National Family Partnership and see how that can be done, if it can be done, and then get back to you. But I've written you down, and so I'll ask that question and then get back to you individually.
Yeah. Are you thinking like
just a still
like before or after the commercial to add in something, you know, that in you know, Buncombe County, here's our statistics, blah, 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 or brought to you by the Partnership for Substance-Free Youth, something like that?
Exactly, after the ad. And it could even be a still shot. It doesn't have to be, you know, but the community themselves have requested that. So if there's any way that we can do that, that would be helpful in there.
Okay. Thank you. Any other questions? Okay, so if you do, I imagine you will come up with questions, again, feel free to shoot us an email or give me a call, and if we don't know the answer to your question, we'll get that as soon as possible. So again, we want to thank you all and welcome you. Hope you guys are as excited as Anna, Aaron, and myself are to get this ball rolling. I think this is going to be a great campaign for our state, and we know that we have some great recipients on the other end that are going to be doing a great job on this. So thank you all, and we really look forward to working with you. You guys have a great rest of the week and weekend coming up.
Thanks, Holly.
Thank you.